What about late fibroatheroma with intraplaque hemorrhage? Now that is the next thing that we should start to recognize, which would also help, but we can recognize the necrotic core. And if you look at by CT, you can certainly recognize the calcium, you can recognize the necrotic core, and you can even see the fibrous cap. That's tomorrow's, I think, technology, which will come in CT. Here are lesions showing you plaque rupture, plaque erosion. Often there is little calcium in these lesions, as you can see here. This is the site of rupture. You can't see, but you can see that it is rich in lipid core. And plaque erosion is even harder because it doesn't necessarily always have a very high necrotic core, but you can have and you can see the lumen is not severely narrowed in these cases. So what should be detected by clinical coronary CT for the identification of future site of plaque rupture and better patient risk stratification? Large necrotic core, fibrous cap, which is infiltrated by macrophages, expansile remodeling, intraplaque hemorrhage, neovascularization, adventitial perivascular inflammation, and you could add fat and fatty spotty calcification. Elucid VascuCap software analysis and histopathology validation study has just been performed, and this involved 125 patients who had undergone CT, MRI before endarterectomy, carotid endarterectomy, and we measured the histologic findings, blinded to the fact that what the CTA or MRI showed. So each one was blinded. And this is what they did. This is to show you that they can recognize, we looked at these plaques, we did the plaque identification saying which one was what, we were unaware what CT showed, and the CT people were unaware what we had seen. So we identified intraplaque hemorrhage, we recognized collagen, we recognized necrotic core, we recognized macrophages, calcium, and lipid pool as well. So these were identified, and eventually they were read and matched, and it was possible to show that they could read these areas. So histologically defined plaque stability phenotype can be readily determined automatically from the CTA across all epicardial vessels in one acquisition.